Hello, this is Dr. Thomas Kramer, and I want to share a quick overview of Prism Care's Patient Health Management Program that helps patients stay engaged in their care between visits. Prism Care has a unique approach called Comprehensive Extended Care Management. We recognize that the most important healthcare relationship is between the patient and the provider. Patients with chronic or complex health conditions often need engagement between their regular office visits. Prism Care acts as a communication superhighway between the patient and the provider. Our highly skilled nurses build trusting relationships with each patient to provide encouragement and coaching between the regular office visits. The nursing team can access multiple tools to help in this process, like chronic care management, remote patient monitoring, assistance with behavioral health issues, or identifying other barriers to care. This service allows providers to more effectively manage chronically ill and complicated patients without increasing their workload or hiring additional staff. Care is individualized to each patient's unique needs. The Prism Care nurses and care coordinators work under the supervision of the provider. Based on the provider's care plan, patients can be engaged with the services and tools to help them best meet their health goals. The Prism Care nurses engage with the patients each month, inform the provider if any issues arise, and upload their notes into the provider's EHR. Prism Care's comprehensive extended care management program delivers 4 clear benefits to providers. First, Prism Care delivers improved patient outcomes and patient satisfaction. Second, Prism Care acts as a turnkey system for implementing value-based care in a practice. Third, Prism Care takes a significant workload off the practice staff, allowing them to work more efficiently. And fourth, Prism Care delivers significant financial benefits to providers without upfront cost or risk. Prism Care's high-touch and high-tech approach is proving to be effective at delivering improved patient outcomes. We did a study of over 1,000 patients who were being monitored for high blood pressure. 27% of those being monitored had initial systolic pressures above 140. After 6 months of monitoring and engagement, the number of patients with 140 plus readings was reduced by 47%, making a huge impact on the metrics for the practices. Patient satisfaction is incredibly high with Prism Care service. Prism Care is an extension of the provider's care team, and this satisfaction reflects directly upon the office. In this study, 300 patients were surveyed and asked a series of questions regarding their satisfaction with their current care management services. We had over 94% that were satisfied or very satisfied with their care and experience. Prism Care helps providers implement and optimize their value-based care programs. Foremost, Prism Care helps patients at the highest risk levels stay engaged in their care. The Prism Care team helps gather data and metrics to meet required quality measures. And patients under monitoring and management have reduced ER visits and hospitalizations, keeping care focused in the primary care office. Prism Care can greatly help with annual wellness visits as well to improve efficiency and advance care planning. Finally, Prism Care services can help improve practice revenue directly and indirectly through shared savings and optimized in-office care. Prism Care can have tremendous financial benefits for our practice. Here's the profile of one of our offices with a single provider in a small town. The office had about $1.5 million in revenue in the previous year, and the provider had about $200,000 in profits. After Prism Care came on the scene, the office revenue went to $2.3 million per year, and the profit went to $456,000. Now, since there's no incremental cost for setup or personnel, Prism Care delivers immediate, positive cash flow with no out-of-pocket risk. What's even better, for every dollar spent on care management, the healthcare system saves between $2 and $5. So that means Medicare and other payers want providers to engage in effective care management programs. It truly is a situation where everybody wins. The next step is to find out if a comprehensive extended care management program will work for your practice. First, we sign a simple BAA agreement and perform a patient practice analysis. From this data, we can create a report and let you know what the benefits might be to your practice. There's no charge for the report, and if it isn't a good fit for you, there's no commitment required. If you do decide to move forward, then we complete a service agreement and get started. And of course, we will provide the training and workflows to make sure everything goes smoothly and our nurses become part of your team. Thank you for taking time to learn about Prism Care, And please call your representative with any questions or visit our website to reach our team.